Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armand Budish, Board of Health Commissioner Terry Allen, UH Rainbow and Babies and Children's President Patricia DePompe, Chief Medical Officer for UH Rainbow Babies and Children Dr. Ethan Leonard, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hello, everybody. First, I'd like to congratulate all of those who ran for election yesterday. Elections are the engine for our democracy. Putting yourself out there before the public, especially in these times when politics has gotten more and more negative, it's all the more difficult, but just makes it more important that good people offer their talents for the voters to consider. And I want to especially congratulate Kevin Kelly and Justin Bibb, who won the right to run in the November election for mayor of Cleveland. Now, once again, I'd like to thank Terry Allen for being here with me. Every couple weeks when we have these briefings and I listen to the COVID news, I feel like things are getting tougher. And that's because they are. But I always know that Terry and his team will keep us level-headed and prepared to fight the pandemic that we're continuing to face. We're well into our third wave, thanks unfortunately to the Delta variant. If we want to keep our schools and workplaces open and more of our residents from getting COVID, we need more people to get vaccinated. President Biden just mandated all private employers with more than 100 workers require them to be vaccinated, or they must be tested for COVID weekly. We're looking at possibilities. For county employees, but keep in mind we have more than 30 unions to discuss this with. In the meantime, we're offering $100 as an incentive for our employees to get vaccinated. So I'll plead with all of you again. Please get vaccinated now. You can easily find a vaccination site near you by visiting covidvaxonthespot.com. I'll repeat, that's covidvaxonthespot.com. It's free, it's effective, and it can save your life. And if you're on Medicaid, the government will give you $100 to get vaccinated. Schools and workplaces need to stay open. We need them to stay open. But our current numbers, which I know Terry and Jan will discuss further, are making that less and less likely. We must do better. We have to stop the spread of this virus, and time is running out. As the weather gets colder and we're forced indoors, chances of spread will only increase. So in partnership with the County Board of Health, effective immediately, we're implementing a mask advisory for all Cuyahoga County residents, regardless of their vaccination status. Our mask advisory strongly urges masking in all indoor areas to prevent a crisis of COVID cases, hospitalizations, and fatalities. We urge our businesses and municipalities to enforce the use of masks in all buildings. And we urge schools to require masks for all students and staff so that kids can stay safe and learning in school. Our fellow Ohio counties have also put mask advisories in place recently. Franklin County, where Columbus is located, Lucas County, which houses Toledo, both of those have adopted the same type of approach. I know masks are annoying. Trust me. I enjoyed not having to wear one after I was fully vaccinated and the infection rates dropped. But wearing masks is a small price to pay to protect our children who are not yet eligible to be vaccinated, and to protect our parents and grandparents and other vulnerable people, and to protect the nurses, the doctors, and other healthcare providers who've been risking their lives since day one. We're doing it for all of them. Thank you, and I'll turn it now over to Terry Allen.
Well, thank you, Executive Budish, again, for your continued support of public health and our efforts and in joining with us to urge our community to mask indoors and get vaccinated to get us out of this lousy pandemic. On August 4th, a countywide statement recommending mask wearing indoors in all indoor settings when around others and a request for everyone to get vaccinated were made in an attempt to blunt the surging Delta variant. This recommendation included universal masking for all staff and students in schools. These evidence-based public health recommendations follow the CDC guidance for an area with high or substantial transmission of COVID. Over the last month, the Delta variant has continued to surge unabated, even as flu season is upon us. Of grave concern is that other respiratory viruses that we usually see among kids in the fall and winter, like RSV and parainfluenza, are already circulating in the community, in addition to COVID. Our current trajectory of cases has us rapidly approaching a level of countywide transmission that is 4 times the threshold identified by CDC as high transmission, 4 times the threshold. Modelers at Case Western Reserve University and the University of Akron have validated this disturbing trajectory, as they are now predicting that we could exceed 1,000 cases per day by early next week if person-to-person contacts and transmission stay at the current levels and trajectories. These levels would represent our worst days from last winter. Area hospitals are reporting that they've reached 80% of their capacity to treat patients who may present with illness, just as flu season is starting and their admissions are predicted to increase. Similar to last year, restrictions on visitation and elective procedures will follow in order to handle the demand to treat COVID-19 patients of all ages. We're also seeing a significant increase in COVID-19 cases from exposures in the school environment, requiring isolation and quarantine of students and staff to reduce risk, interrupting the in-person education that we know children need. Just yesterday, Governor DeWine provided clear evidence that COVID cases are higher in schools that are not masking compared to schools that do require masks. Masks will stop the surge of cases in schools. The governor also noted that we are not alone, as all 88 counties are now in high transmission. In fact, he said the whole state is on fire. Given these disturbing trends, the children's hospitals across Ohio joined together to urge schools to adopt universal masking requirements to protect children and families. And you'll hear this afternoon from Patty DePompe on the impact of these very concerning trends among our children based on the experience that they are having at Rainbow Babies and Children's Hospital. Clearly, conditions continue to deteriorate and the risk is rising. If you want to keep our schools and workplaces open, we must meet the imperative to vaccinate more people now and embrace universal masking in all indoor environments when around others. If you're unmasked and unvaccinated indoors and around others, your risk for contracting COVID is very high and will remain so throughout the fall. On the vaccination front, about 54% of residents, just over half of us, have been fully vaccinated, and about 33% of the African American population and 44% of the Hispanic Latinx population have been fully vaccinated. This means that many of us remain unvaccinated and therefore vulnerable and at risk for contracting and spreading the Delta variant in the community. We urge everyone age 12 and older to get vaccinated as soon as they can. Vaccinations are readily available in many places: health departments, hospitals, pharmacies, and community health centers. The data is very clear. Almost all the hospitalizations and fatalities are associated with unvaccinated people. We have to embrace our shared civic responsibility to protect and save as many lives as we can from the ravages of the COVID-19 pandemic and protect our hospitals from being overrun and unable to treat those who need care, particularly our children. Sadly, we're also bracing for increases in fatalities that follow surges in cases. With today's county mask advisory, I join Executive Budish to urge all businesses, nonprofits, cities, villages, and townships to require masks in their buildings and promote vaccination. If we all do our part, we can still avoid the worst if we act now. We continue to collaborate with local foundation community, other government agencies, nonprofits, community health centers, hospitals, and grassroots agencies to spread the word on the many locations where vaccine is available in the community. It is by far the leading public health prevention strategy that can slow the spread of COVID in the community and ultimately end the current pandemic. Vaccines continue to be readily available, and remember, you can go to gettheshot.coronavirus.ohio.gov or by calling 211 to find out where you can get vaccinated. Currently, those whose immune systems are compromised moderately or severely are eligible to receive an additional dose of the mRNA COVID-19 vaccine after the initial 2 doses. So that's for Pfizer and Moderna. This group represents about 3% of our population. Given the particular risk that these health conditions pose, we recommend that these individuals contact their doctor to get their 3rd dose now as we enter the fall. On September 17th, a key federal advisory committee will be meeting to discuss recommendations related to boosters. We are awaiting the details and guidance from these deliberations to determine how the booster process will roll out. And we, of course, at the health department here will be working with hospitals, pharmacies, community health centers, and the Cleveland Department of Public Health as we share the responsibility to provide booster doses and continue to offer 1st and 2nd doses in Cuyahoga County. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms. And we're seeing major increases in testing volume with the emergence of the Delta variant. We advise parents, students, school faculty, and administrators to go to retail pharmacies to get tested, especially for asymptomatic exposed students and patients. Currently, we understand that area libraries may be out of test kits and are awaiting additional shipments from the state when they're available. Area hospitals have requested that if you are symptomatic and stable or need a confirmatory test, please go to the outpatient care centers or primary care offices for testing. Do not go to the emergency department for testing. It's important to keep our emergency rooms free to help those most in need. Please also remember that everyone with a known contact to someone with confirmed COVID-19 disease should get tested 3 to 5 days following exposure. It's important to isolate if you have tested positive for COVID-19 in the prior 10 days or are experiencing COVID-19 symptoms, and also to quarantine if exposed to someone who tested positive based on guidance from your local health department. These are proven public health interventions which are key to stopping the spread. Frankly, we may be reaching the point of no return in this current surge if we don't act now to get vaccinated and mask up. Do it for the nurses, for the doctors, and other healthcare providers serving our residents. Do it for the teachers. Do it for the children who are not eligible yet to be vaccinated. Do it for our elderly and other vulnerable populations. And most of all, do it to save as many lives as we can in our community. Thank you for your time and attention. And now I'll turn it over to Patty DePompe.
Thank you, Commissioner Allen. I am joined today by our UH Rainbow Chief Medical Officer, Dr. Ethan Leonard, who is also a pediatric infectious disease specialist. Ohio is truly blessed to have some of the best children's hospitals in the country. We pride ourselves on meeting the healthcare needs of our kids. Our commitment is really threatened right now. As you have heard, we are now experiencing a sharp rise in pediatric COVID-19 cases, primarily driven by the Delta variant. But we also have increased respiratory illnesses such as RSV, a sharp increase in children requiring admission for mental health needs, and with this rise in volume, staffing challenges. This scenario is a perfect storm. For a long time, COVID-19 was perceived as a disease that didn't impact children. That's not the case anymore. Today, 25% of COVID-19 cases are in kids, and COVID-19 cases are increasing at nearly twice the rate among school-age kids as compared to the rest of our population. As of yesterday afternoon, we have now had over 155,000 cases of COVID-19 in children under the age of 17 in the state of Ohio. 1,528 of these children were ill enough to require hospitalization, with some of those children requiring long intensive care unit stays and interventions such as ECMO or heart-lung bypass. Tragically, 8 children under the age of 17 have now died in our state from COVID-19. We have had multiple examples around the state and at Rainbow where children needing to be transported to other children's hospitals due to lack of ICU beds. Our emergency rooms and urgent cares are seeing unprecedented volumes, as you heard from Commissioner Allen. We are testing tens of thousands of children across the state each week. Over 3,800 children were tested last week alone at Rainbow, and our positivity rate on symptomatic children has climbed to 11.2%. I believe everyone can agree that our number one goal is keeping children healthy and in schools 5 days per week. As Commissioner Allen referenced, in Ohio, school districts where masks are optional among school-age kids, there are both higher case rates and a greater week-over-week increase in COVID-19 cases. We are asking and urging all Ohioans and Cuyahoga County residents to do what you can to protect our county's children by using proven tools that we have. If you are eligible, please get vaccinated. Please wear a mask in indoor venues and support your school district in assuring that all children are masked during school. Please adhere to proven safe practices of physical distancing and hand washing. Together, we know we can keep our children safer. They need us to each do our part, and they need us now. And I'm really pleased to turn it over to Director Jana Rush. Jana.
Okay, good afternoon. I will be covering some of the key metrics and trends that we've been seeing with COVID-19 as the Delta variant is surging throughout Ohio as well as in Cuyahoga County. So for our reported cases, we're currently averaging about 300 cases per day. Just to put that into perspective, that's over a 600% increase from where we were just in July. We were averaging about 35 per day. So a very sharp increase in the number of cases that we're seeing in a very short period of time, which is different than what we were seeing back in the beginning of the fall of 2020. And currently our incidence rate, we're at about 357 cases per 100,000. This remains lower than the state average, but as was mentioned earlier by Commissioner Allen, the entire state of Ohio is in the red zone, meaning that we have a high incidence of transmission happening throughout the entire state. And it was also mentioned about the trajectory of the cases that we're expected to see. So last year, we saw over 1,000 cases per day being reported. That was back in November and December of 2020. And so now we're at pace to have that happen much earlier, meaning that, if that happens within the next 30 days, we can be well over even 1,000 cases per day as we move further into the winter. And so something else that I want to highlight today is to talk about children and schools and what we're seeing in cases amongst that population. So what we've observed is that school cases have continued to rise each week since the beginning of the 2021-2022 school year. We've had the highest case count reported this school year with 426 cases being reported to date. So we've also noticed that we've had an increase of about 50% every week in the number of cases among children in schools. And that's 50% higher as well than what we were seeing in the 2020-2021 school year. So we're already starting out, with a much higher number of cases being reported among school students. To date, there's been nearly 1,000 cases reported total for the school year, with over 80% of those occurring just in the last 2 weeks. So what we're seeing here with those school cases is that they're rapidly increasing in a much shorter, condensed amount of time than what we were seeing last school year. And our highest number of cases are among those that are 16 years of age and 17 years of age with a median age of 12. We had 130 children, 0 to 17, that have been hospitalized so far. And the highest number of those cases have been among those that are less than 1 year of age and those that are 16 to 17 years old with a median of 11 years of age. And just over the past 2 weeks, you know, a trend that we noticed or that we're starting to see is that the number of hospitalizations among children just over the past 2 weeks, so among those 0 to 19, has matched those of adults that are 50 to 59. Very unfortunate, but that is the trend that we're starting to see with this Delta variant. And then among those that are 0 to 17, about 14% of children are currently vaccinated within our jurisdiction. So we know, of course, that's much lower than what we see in our adult populations, where we have upwards of 50% or more, and that increases with age with the number of those that are vaccinated. So I'll move on and shift to testing. So countywide, our positivity rate again has increased. So we've went from a 6% positivity rate to now we're over 6.5% through the end of August. So we were at 6% mid-August. So that rate represents the highest rate we've seen in ODH since we began this countywide reporting. And so we've also noticed that the number of tests have also increased that are being sampled. So over 70,000 tests were ran just over the past week. Again, that's more than double than what we were seeing just back at the beginning of August. So in relation to vaccinations, as Commissioner Allen also stated earlier, we've pretty much been at a stable rate of having about 53% of the population in Cuyahoga County fully vaccinated, and that's just remained stable. So we kind of stalled there in relation to the number of people that are being vaccinated. But we are seeing an increase most recently over the past 2 weeks. Just last week, we had 6,000 residents who were vaccinated for COVID-19 and completed that, and we were at 3,000 at the beginning of August. So that's double of what we were seeing just from about a month and a half ago. So that's encouraging to see, since we've kind of been flat around that 50% range for vaccination in the county. And then for hospitalizations, we're currently averaging about 300 patients per day that are in the hospital due to COVID-19. We are learning, as we stated earlier as well, we have 80% utilization with our adult beds, and we're at about 50% for our pediatric beds. But we are also learning that for our ICU beds, we're at more than 90% capacity. So we're definitely increasing significantly there as well. And so, we have to be mindful of that as diversion starts to happen, where we're not able to have people come into the hospital for other things that may be of concern for patients. And so with this surge in cases, we're also seeing the deaths increase. So we began averaging about 2 deaths per week earlier in the spring as cases had began to subside, and that's now increased to about 5 deaths per week. And then just last week, we had 9 deaths reported in the matter of 1 week. So as you can see, again, the same trend is happening with cases, hospitalizations, as well as deaths. These cases are doubling, tripling, sometimes just within a very condensed time frame. So within 4 weeks to 2 weeks, we're seeing these things kind of snowball over the last several weeks. Another statistic that I wanted to point out is that our average age for our deaths is still older adults, so 78 years is the average age, but we do have a range of 28 years to 102 years for people who have died as a result of COVID-19. So it definitely does impact younger people as well as older people. And 98% of all of the deaths that have occurred during 2021 have been attributed to those who are unvaccinated. So we still know that the majority of the severe outcomes that are resulting from COVID-19 are in relation to those who are unvaccinated. And another statistic that I want to point out is that the ratio of deaths among those who have contracted COVID-19 compared to those who are vaccinated or unvaccinated, I'm sorry, is 40-1. So we know that, again, vaccination is really protecting people from those severe outcomes, 40 times more likely to result in a severe outcome of hospitalization, particularly here for death, is 40-1 for people who are unvaccinated. And so in closing, what I want to mention is that Delta is different. We are seeing a difference in transmission and the populations that are impacted due to the Delta variant. It is impacting people that are younger. We are seeing transmission and breakthrough cases happen, especially, like I said, amongst those who are vaccinated. We're seeing more severe illness happening with those patients. And so we need to do all that we can to prevent this fall from being worse than last fall. And at the trajectory that cases, hospitalizations are rising in such a short amount of time, we're definitely on track for that to happen. But what we can do is the same basic public health measures that work: vaccines, masks, social distancing, isolation, and quarantine. There are tried and true public health methods that work to help prevent the spread of COVID-19. And so I know that, as we've said many times before, we're all tired, but we all have to continue to do our part if we want to avoid the most difficult paths that are ahead that may impact our day-to-day lives. And with that, I'll close and turn it over for questions. Thank you.
All right. Thank you, Jana, and thank you all for your remarks. We now have a few questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So does anybody have a question?
This is Lisa Ryan with WCPN IdeaStream Public Media. And I'm wondering what the mask advisory actually means. Will there be any requirements? How will you be getting messages out to businesses and other places to try to get them to require masking in indoor public spaces? What are some of the more details about that?
Thank you, Lisa, for your question. Yes, so we will have the advisory posted on our website, and we would then work with our Mayor City Managers Association. We'll work with our local associations through chambers, et cetera, to get the word out, to make sure that people are aware. We know many municipalities have already tried to move forward to adopt a masking recommendations or masking requirements in buildings, particularly in senior centers, which certainly makes good sense. So we'll spread the word out after today with the notice of it. And what the difference here for us is that we now know the level of urgency that you should be hearing in the voices of everyone that's participating today. It shows us that at this point, we're in the precipice of whether we are going to be able to suppress this variant, or we're in for a very, very difficult fall and a lot of heartache that we can avoid if people begin to adopt these measures, if they get vaccinated, if they wear a mask. We know the data is clear that in school environments, if you're masking, you're going to have less cases. That's been made clear statewide. President DePompey just described that. So certainly we want you to now embrace this. We've seen more in public settings, in stores, that people are starting to mask. I do think that if you set examples as you're moving about the community, other people will follow suit. But we have a civic responsibility to protect each other. And we want to protect our kids. We all want to protect our kids. So this is the best way to do it. You roll up your sleeve if you've been waiting for some reason, and you wear that mask. And we'll all be better off. But we'll spread the word in the wake of today's announcement, Lisa. So thanks for your question.
In addition,
Sorry.
That's okay. I was just going to add that we also will work to get the advisory out. We have active social media presence. We have our website, which is well viewed, and we're regularly meeting with organizations and leaders throughout the community.
But there isn't any consequence that will happen if people don't wear masks. because I'm wondering if people will hear this and think that they won't have to change anything.
Well, I think we're hoping that people certainly we're calling upon their better angels at this point, because we really recognize that when kids are when they're having issues, we heard reports, and President DePompe described what's happening in the Children's Hospital here, but reports from around the state, where in Toledo they had to go on diversion where none of the hospitals were available to serve people in their community for an 8-hour period. They were all full. So there was nowhere for anyone to go that needed help for any reason in an emergency care. And certainly Dr. Leonard can describe what he's seeing and the pain and suffering that people have experienced in those settings. We want people to take that to heart. And what's different from last year this time is we are not in a lockdown. We are seeing the distancing. We don't have the remote work to the degree we did. People are moving freely about the community, and there has been less masking. And so we need to recognize that's what's different, and Delta is different. So there are a number of things now that make our risks significantly higher going into the fall. And we don't want to have a very, very dark winter. We want to have a better outlook by engaging people and appealing to them now to do the right thing, and to do it not for them alone, but for all the people around them and for the kids.
Thank you, Commissioner Allen. I'll say that we have seen almost a doubling of our census of children admitted with COVID. We serve a several county region. We're diagnosing about 60 cases of COVID a day. About 5% of those need to be admitted. We have several of those children in our intensive care unit requiring a breathing tube and a ventilator, or non-invasive ventilation modalities that we talk about. But these are sick kids, and they're almost uniformly unimmunized, either because their family didn't get them immunized, they're too young to be immunized, and the families weren't immunized. So again, we can't implore people strongly enough to get immunized, to wear a mask, and to protect our kids and the rest of the family members.
And I will add, we've also opened a long COVID clinic just for children, because the sequelae of COVID doesn't stop once a child's discharged from the hospital. There can be sequelae that last for months. And these are kids that really are suffering. And again, we can't emphasize it enough. We all have to protect each other, but especially those who can't be vaccinated. And right now, those are children under the age of 12.
When you ask about the consequences, I'll answer from my view directly. There's no fines. There's no criminal penalties. The consequences are people will get sick and some of them will die.
All right. Well, thank you for your questions. Really appreciate it. That concludes this week's briefing. Thank you for joining us, and we will see you in a few weeks. Have a great day.
Thank you.
Thank you.